Hello. My name is Jones, and today we are going to look at psychiatry nursing skills. Okay, so in looking at this topic, we can also appreciate it in the angle that we are looking at mental health nursing skills. Okay, so these skills that we are looking at can be used in nursing or giving care to patients with mental illness. Okay, so the objective of this lesson is to explain all terminologies that are used to do with mental health skills or psychiatry nursing skills. We are going to look at the psychiatry nursing skills or mental health nursing skills that are there. And then we also look at the importance of self-awareness. We're going to discuss the JoHari window. We will outline counseling skills, discuss also and explain what stress management is. We will also explain the principles of counseling. Okay, and we are going to also look at restraining, okay, as one of the skills that is needed in mental health nursing. So our main topic is mental health nursing skills. Mental health nursing skills. Okay, so mental health or psychiatry nursing skills, it would be looked at to just be the same. Okay, because we are dealing with a patient with mental health problems or patient that may have a psychiatry problem. Okay, so some of the key terminologies that we need to appreciate within this lesson, okay, are terms like therapeutic relationship, social learning, terms like behavioral modification, stress management. We look at terms like self-awareness, communication, and also the term skill. Okay, so when we use the term skill, we can put it into context necessarily as looking at the ability to do an activity or a job effectively and efficiently, especially after one has practiced that task. So when you're looking at the term skill, we are looking at someone who has got the ability to perform a task efficiently and effectively after some time of practice. And then the other terminology that is common or that we need to familiarize ourselves with as we look at mental health nursing skill is communication. Communication can be defined as a reciprocal exchange of information, ideas, beliefs, feelings, and attributes that can happen between two or more people. Communication is simply exchange of information between two or more people. But I would not want to go in details and talk about other types of communication that are there where one stands to talk to himself or herself. Okay, so that is how we can look at communication. So communication here becomes very cardinal because for one to nurse a patient with mental illness, they need to sharpen their communication skills. When they sharpen their communication skills, then they can use communication as a therapy. Okay, so the other term that we also need to familiarize ourselves with is self-awareness. Self-awareness involves looking inwards to understand oneself objectively, okay, and also examine one's beliefs, values, attitudes, motivation, strength, and limitation. This means that the nurse must be able to examine their personal feelings, actions, and reactions. However, no one ever completely knows himself, okay? And of course, this is according to the JoHari window. No one completely knows self because there are some times where people know us and we do not know ourselves that we are like that. Okay, so another term that we need to appreciate is stress management. Stress management involves use of coping strategies that protect the individual from harm in response to stressful situations or stresses. To prevent people with a vulnerability to mental illness or falling sick, they can be taught on how to manage stress or managing precipitating factors of stress, okay, so that they do not end up having a mental breakdown. Then the other term that we also need to appreciate is the counseling. Counseling is a method of relieving distress undertaken by means of a dialogue between two or more people. The aim is necessarily to help the client find their own solution to the problems that they have, while being supported and being guided by the counselor. The person being counseled being the counselee. So communication, also the counseling, can be looked at as a therapeutic communication that happens between a counselor and a counselee. Okay, so the other terminology that we need to acquaint ourselves concerning mental health nursing skills is behavioral modification. Okay, so behavior modification can be looked at as a practice that treats behavioral problems. It is based on operant conditioning and social learning. Okay, so when we're talking about behavior modification, okay, with its link to operant conditioning and social learning, we can then look at some of the terminologies also that we can find in operant conditioning. Okay, so there's operant conditioning, there's classical conditioning, okay, and there's also social learning. So in these conditioning, these types of conditioning, or conditioning in psychology, is used to mean the same as learning. Okay, so there is what they call positive reinforcement. There is also some terminologies that is extinction, which is going to be relevant to our lesson in the mental health nursing skills. So when we talk of positive reinforcement, it's adding a rewarding stimulus as a consequence of a behavior, thus increasing the probability that that desired behavior will occur. So positive reinforcement, you add a reward for each and every good behavior. Then negative reinforcement, okay, is application of an aversive stimuli for inappropriate behavior. So positive is reward, whilst when you talk of negative reinforcement is applying an aversive stimuli. Okay, so other terminologies, of course, that we may come across when you're looking at classical conditioning is also, or parent conditioning is also punishment. So punishment is looked at differently as compared to negative reinforcement. Whilst in punishment, you apply some kind of stimulus that is painful, okay? When you talk of negative reinforcement, it does not necessarily have to take a painful stimulus being applied in order to deter patient from exhibiting behavior that is undesired. So positive reinforcement, negative reinforcement, and even the issue of punishment. We do not punish our patients, so I would rather, when you're talking about mental health nursing skills, okay, you apply the issues to do with positive reinforcement or negative reinforcement. Then there is extinction. Okay, so extinction is when positive reinforcement for a particular response or behavior is withdrawn, and then the behavior usually stops. So extinction, a certain behavior will stop because the reinforcement, the positive reinforcement that was attached, is no longer being applied. Okay, then when we talk of social learning, okay, socialization is also synonymous or may mean the same as learning, but is from the sociology point of view. Socialization is learning. So when you talk of social learning, here it can happen through observation, it can happen through assertive skills, it can happen also to do with social skills that are acquired during socialization. So social learning is a strategy that is used to form new behavior patterns by observing a person modeling the behavior in a controlled environment. Okay, so in mental health nursing, when you have structured a controlled environment and then you apply some therapy, we call that Merrill therapy. So Merrill therapy is a modified controlled environment in which you try to model patient's behavior to that which is desirable within the community or society. Okay, so the person now who is learning from this behavior in social learning, they will now imitate the model, okay, or the person trying to model the appropriate behavior that is desirable. Okay, so social learning or socialization, here patients may attain assertive skills, may attain social skills, and this is achieved through objective observation by the patient with a model that is brought up before this patient. So to achieve social learning, you need to apply Merrill therapy. Okay, that is modify patient's environment so that patient can observe the appropriate desired behavior. Okay, so it is also important when you're talking about mental health nursing skills to also talk about therapeutic relationship. Okay, when you're looking at therapeutic relationship, you are just looking at an interaction that is between two people, usually a caregiver and that one who is receiving the care from the mental health nurse or from the nurse. So therapeutic relationship and interaction between two people in which input from both parties contributes to a climate of healing, growth promotion, and illness prevention. So that is what we mean when we say therapeutic relationship. A relationship that is aimed to provide remedy to the undesired situation, okay, or undesired state. Okay, so a therapeutic or therapy, it's more like helping. So therapeutic relationship here, you have established a relationship through which you are going to use basic skills of counseling in order to help the patient recover from their condition. Now, with these terms or common terms defined, okay, to do with psychiatry nursing care or mental health nursing care, it is important that now we look at the actual mental health nursing skills. I'm going to simplify this using a mnemonic BRASCOT, BLASCOT. Okay, so for each and every mental health condition, or for most of the mental health conditions that are out there, okay, you may apply BLASCOT, or you may apply all these skills. Okay, so BLASCOT is a mnemonic for mental health nursing skills. And it is important or prudent that you apply this. B is for behavior modification. All patients with mental illness may need some kind of behavior modification because their behavior has become deviant to society norms. So behavior modification is very, very important. Behavior modification or behavior therapy here becomes very, very important. Then restraining. Restraining is a skill that is applied in order to help patients who are violent and cooperative in order to be immobilized. These are patients who pose danger to self or others. If restraining is not applied, these patients may harm self or others. In short, they might kill themselves. So we are going to talk about the types of restraining that is there. Then A is assertiveness, or assertive skills that the patient should be taught, or that the nurse should have in order to teach the patient about assertiveness. So the nurse should have assertive skills so that the patient can go through assertive training. Okay, then S is for self-awareness. S is also for social skills learning. Okay, so patient needs to be taught about self-awareness, or the nurse needs to have self-awareness skills so that they can impart that knowledge to do with self-awareness. Social skills training, this is more to do with helping patients to socialize or learn society norms. So the nurse should have this skill of helping the patient to model or imitate behavior of a model that has the appropriate desired behavior, that is expected within the community. C in Black Coat is communication skills. Okay, so communication is good therapy for patients with mental illness. So it is important that the nurse becomes aware of their non-verbal and verbal communication, and also understand the implication that these things may have, as they may have some kind of bearing in the care that they give to the patient. So C is for communication. Then O is observation. You need to have assessment skills or observation skills in order to note how patient is improving. This can help you to draw up an activity plan for the patient, so that when they start to exhibit that behavior which is appropriate, then you can discharge the patient. Okay, then T is therapeutic nursing intervention skills. Okay, applying therapeutic nursing intervention skills is very, very important to help the patient recover. Okay, so let us look at all these skills that we have talked about in a little bit of detail. And as we are looking at all these, remember, the patient has to pass through some kind of admission process, before we start nursing them. So there may be different types of admission as to how the patient will come into the hospital. So it is important, as you are nursing a patient with mental illness, you master the admission procedure, and also have as a skill, discharge planning. So you need to plan patient's discharge so that when the patient has reached a certain extent, they can be discharged, and these patients will be able to adapt within society. And if that cannot happen, you do not know the process of admission, you do not know the admission procedure or the discharge planning, you may discharge patient prematurely. And if you discharge patient prematurely, it becomes very difficult to incorporate them at home so that they can live within society. So communication skills. So some of the elements that you have learned about communication skills includes the source, message, channel, receiver, and feedback. And some of the modes of communications that are out there include written, spoken word, and non-verbal communication. So when nursing a patient with a mental illness, it is fundamental for you to understand the implication of your body language. It is important for you to understand the implication of your spoken language. Of course, if I talk about the modes of communication to do with written, it has to do with the report writing. Okay, you need to write your report professionally so that other staffs and professionals can follow your work nicely. Now, there are certain choices of words that within themselves and the tone of a voice may sell out someone that they are exhibiting aggression. So now here communication becomes very important. You cannot talk to the patient who is talking on top of their voices and then you also talk on top of your voice. Here you are likely to trigger some kind of friction. So for the spoken word, if the patient is talking on top of their voice, then you need to tone down on the voice so that you do not trigger some kind of friction. And then the non-verbal gestures that you make. Some of them, they can sell you out as if you are showing aggression to the patient. So with this awareness, you are going to restrict your body language as you are speaking to the patient so that the patient may not perceive these as aggression. So when you are writing about communication skill or communication therapy, I would want you to have this at the back of your head as you are nursing patients with mental illness. Have an awareness of the spoken words as you are interacting with the patient. Have awareness of your body language or your non-verbal communication. So apply it professionally so that you do not enter into an altercation with the patient. The written part is you professionally writing a good report, a good report about the patient so that another person, when they come, nursing is a continuous process. When another person comes, they would be able to know where to pick up from. Okay, so those are some of the items that I can talk about when you are exercising your communication skills in your psychiatry nursing care or in your mental health nursing care. Okay, so now let us look at another skill, from Blaskot, which is restraining. So restraining is reserved for patients that are a danger to self or others. There is risk of them committing suicide. There is risk of them harming others. So for such patients, in emergency situation, we are going to apply restraining measures. Okay, so you might look at it to say, oh wow, where are you getting these skills? You need to know that there are a lot of skills out there other than the Blaskot that have the mnemonic Blaskot that I've come up with. So restraining has been there, but you might find it that others might not so much emphasize it. So restraining in emergency situation where a patient is uncooperative, is too much mobile, and you want to immobilize the patient, you can apply restraining. So restraining is used to restrain or immobilize the patient, who is uncooperative and poses danger to self or others. So there are three types of restraining. So the first type of restraining is a physical restraint. Physical restraint is necessarily applying, let's say, a bed sheet, tying the patient so that the patient becomes immobile in bed the period when they are uncooperative, they are violent. So during that period you may apply that. But otherwise, there are special restraints, belts that are padded that you can tie the patient to the bed, or you can use to immobilize the patient. So you have to be You do not need to use, police handcuffs for this, because they may pose a danger of physical fracture on the patient. So use padded restraints, that are out there. But mostly you find that because these restraints might not be readily available, people may just use bed sheets to tie the patient. So as you apply these restraints, ensure that you also apply the other knowledge to do with anatomy and physiology. Remember, blood circulation should not be impaired, or else it may lead to the other part, where blood is not supplied to become necrotized. The other part or tissue which has got poor blood circulation, may become necrotized. So there is physical restraints where you tie the patient using restraint devices. So I've mentioned some of the things there that you can look out for when you're applying restraint. Then, apart from that, there is chemical restraint. Chemical restraint, here is a patient who is uncooperative. They are moving up and down, poses danger to self and others. You may apply what we call chemical restraint. Chemical restraint is giving a drug like diazepam, carbamazepine. This is to help calm the patient. So you can give benzodiazepines, they will help to calm the patient. This is during the active stage when the patient, is too mobile, and there is a risk that is there for if patient continues to exhibit such behavior. So remember, aggression can come as an emergency, mania can come as an emergency. So restraint as skills or restraining as therapy may be applied for such patients who come a little bit restless and more in panic. Then the third type, or the third way of applying restraints, is seclusion. Seclusion is like isolation when you are dealing with a medicine. Those patients that are infectious, you isolate them so that they do not spread the infection. Now, seclusion here, we are saying those patients that are violent, those patients that are aggressive and pose danger to self and others, you may have what we call a restraint room. A restraint room that does not necessarily have anything that the patient can easily use to harm self. So patient is locked up in a room, so that when they exhibit change in behavior, they can be allowed to mingle with others. So they will be in a restraining room. Of course, the names of whatever you might call this room might be different, but what I'm saying is here you seclude the patient. Seclusion as the third type of restraint. You seclude the patient, in a private room that does not have anything that can harm the patient. No source of which they may touch electrical cables and harm themselves. So they should not have that. There should be no ropes that patient can use and commit suicide. So that is how your restraining room should be. It should also have a window for easy observation of the patient, and during this time, you can have also some therapeutic communication with the patient when appropriate, and do not starve the patient. Restraining should not be applied to suit the nurse as a professional or any medical professional who is nursing patients with mental illness. It should be done, to help save the patient. Not because you want to buy time, then you just restrain your patient because you want to go and watch football, within the ward and leave the patients alone. No, it should be applied because there is more benefit that is there to the patient. If it's not applied well, it may be looked at as abuse. Okay, so now with restraining, with restraining skills mentioned there, we can look at another skill, which is self-awareness. Self-awareness involves looking inward to understand oneself and objectively examine one's beliefs, values, attitudes, motivation, strength, and limitation. This means the nurse must be able to examine personal feelings, actions, and reactions. Okay, so self-awareness, as already indicated when we talked about definition, definition of terms related to mental health nursing skills. So self-awareness is fundamental to ensure the most effective use of self, and it's also fundamental to be aware of a personal stress that can interfere with our ability to communicate therapeutically with our patient. If, for instance, the nurse is tired, they may be anxious, they may be agitated, they might be apathetic, and at this moment, temper and mood may set through, and it becomes very difficult for you to convey interest in the concerns of the patient. Okay, so when you have self-awareness skills, you understand that there's also burnout. Burnout, to do with, there can be mental burnout, there can be physical burnout, you being overworked. So it's important that you understand yourself so that you can give effective care to the patient. Self-awareness also becomes fundamental because it will help the nurse avoid social biases that may influence the way they interact with the patient. Social awareness also becomes important because the messages nurses are going to communicate verbally and non-verbally to the patient can also be clear and acknowledged, within the patient's feeling, within the nurse's feeling or attitude. So when you're experiencing some kind of burnout, your communication might be different, might not be the same. It's like when you are reporting for work, you are all freshened up and your communication, you are energized. But when you're about to knock off, the zeal, energy for you to work is not so much there. So this can be seen or read by the patient, in the nurse or in the practitioner that is caring for the patient. So when you have self-awareness, you also understand and accept yourself, and also acknowledge the differences and uniqueness that is there between our patient. So it is important to have self-awareness so that we know ourselves better and how our behavior, our actions and our attitudes, the bearing that they have on the patient. So now the other skill that we need to have as nurses or caregivers for patients with mental illness, it has to do with the assertive skills. So when the nurse has assertive skills, they can learn by participating in groups. So this will allow you to also help patients to participate in a group work. An island, patient should not be an island. So if patient has become assertive, or if you apply assertive skills, you are going to teach patient to participate in a group work. So assertive skills will also enable you as a nurse in order to watch staff and also demonstrate these specific skills as they are caring for the patient with the mental illness. So because you have these assertive skills, you can now also observe them in the people that are caring for the patient within your wards. So assertive skills may play a very big role, and the staff can provide feedback to patients on the appropriateness and effectiveness of their responses if at all they participate in these groups or group work that you give them. So in assertiveness, our emphasis should be so much on a group work. Okay, things that you can give to the patient to do in a group work, and also observing them how they are working together and respecting other people's roles in contributing to the success of the program. Okay, so if you have assertive skills, you also assign your patients, okay, with some kind of work that they can do, and then you can also help reduce competition within the patient so that it does not act as a negative factor in helping to shape the patient behavior. Okay, aggressive behavior in group work might be seen. So it's important when you have assertive skills, you have this awareness and then apply this skill nicely in helping the patient, patient do group work. Okay, so training a patient to be assertive is necessarily helping patients incorporate themselves within the group. Okay, accept that in each and every game within a life, there can be losses, okay, there can be gains. And when you have a loss, it does not mean you have to become angry, but you have to go back to the scoreboard, see where you made mistakes, and then move on, so that the next time you're making a step, you can be successful. So you should have assertive skills as a practitioner, okay, so that it can be looked at as a mental health and nursing skill. So you can apply assertive therapy on the patient if you have assertive skills. Okay, so in talking about assertiveness, I would also want to talk about also the JoHari window. Okay, the JoHari window helps one to understand himself better. Okay, it consists of 4 quadrants that represent, okay, the total of self and the others. Okay, so quadrant 1 necessarily talks about known to self and others. Okay, it includes behaviors, feelings, and thoughts that are known to individuals and others. Then it has quadrant 2, okay, which talks about known only to others. Okay, so when you're looking at it as known only to others, we are looking at an open secret, because it includes all the things that others know, okay, but the individual does not know about themselves. Okay, so known only to others. Others they know, but they have not come out to tell you that this is ABC or this is what they know about you. Then quadrant 3 is known only to self, okay, which includes the things about self that only the individual knows about themselves. So known only to self. So we have talked about quadrant 1, known to self and others, known only to others, then known only to self, and then quadrant 4 is unknown. So unknown to both self and the others. Okay, so when we are talking about having skills to care for patients with mental illness, okay, and also incorporating the understanding of the JoHari window in mental health nursing skills. The goal is to help patients have an increased self-awareness to enlarge the area of known to self and others, and also reducing the size of the other quadrants. So person needs to understand themselves a lot. They need to have good self-awareness, okay, so that they may understand their interaction within the community, so that they can be assertive. Okay, so with that mentioned, let us now look at stress management. Okay, Stress management as a mental health nursing skill involves the use of coping strategies that protect the individual from harm in response to stressful situations or stressors. Okay, so to prevent people with vulnerability to mental illness or falling sick, you need to apply stress management skills. Okay, or you need to teach patients stress management skills so that they can deal with precipitating factors, okay, and already existing vulnerabilities that they may have, and hence avoid mental health conditions. So to talk about stress management, if you are a computer lover, okay, I would say you can use RAM. Okay, in stress management, you need to teach the patient about coping strategies. So coping strategies, in coping strategies, we can use the mnemonic RAM. RAM, to do with computer language, that is random access memory. Okay, and if you are a lover of, let's say, physical education, you can use the word ARM, that is ARM, okay, as a coping strategy. So when you're using coping strategies for stress management, you're using this mnemonic ARM or RAM. A is for awareness. Okay, for you to manage your stresses very well, you need to become aware of stressors, so that you can omit them, avoid them, or accept them as part of life and see how best to resolve them. Then the other coping strategies for stress management is relaxation. Through physical exercises, breathing exercises, and muscle relaxation, it will help us to relax our bodies. Okay, then there is meditation for aim, that is seeking support and talking to others if anxiety is too much. Okay, so in stress management, apply coping strategies. What are the coping strategies? That is mnemonic RAM. Awareness, relaxation, and meditation helps you to manage your stress. This now takes me to another one, which is a behavioral modification. Okay, so behavioral modification skill is very important in mental health and nursing, okay, as it is a practice that treats behavioral problems. It is based on operant conditioning and social learning, as earlier indicated. It is based on the premise that all behaviors are learned and therefore they can also be unlearned. So this skill, okay, we will focus, or it will look at bad behaviors that someone might have copied. And also it will look at some good behaviors that one might have copied. For example, positive reinforcement can be used as to help us add a reward stimulus to the consequences of behavior that are appropriate, okay, so that the patient will repeat this behavior which is desirable. Then negative reinforcement, it will be applied to deter socially unaccepted behavior. Okay, so now with behavior modification as a skill talked about, we also mentioned that there should also be issue of social learning. Socialization in sociology perspective, it's more to do with learning. So there should be a model, or you can apply Merrill therapy, okay, within behavior modification, so that the patient can imitate appropriate behavior from the desired model that is within the patient's surrounding or environment. So Merrill therapy is modification of patient environment so that the patient can copy the appropriate behavior. Okay, so in Blaskot, of course, there is a T. Okay, T in Blaskot is for therapeutic nurse interventions. Okay, therapeutic nurse intervention skills. Okay, so therapeutic nursing interventions or skills mostly, okay, this has to do with an interaction that is happening between two people, okay, in which input from both parties contributes to a climate of healing, growth promotion, and illness prevention. So these two people here that are involved in therapeutic nurse intervention are usually the caregiver and the person who is receiving the care. A therapeutic, from our definition, we looked at it as helping someone, okay, or giving a remedy to an erring behavior or ill health. It can be those. So in therapeutic intervention skills, there can be counseling skills also applied within this. Okay, so counseling skills also tend to exist on its own when you're looking at the skills of a psychiatry nurse or skills of a mental health nurse. Okay, so therapeutic intervention skills has 4 phases. There is the pre-interaction phase, there is the orientation phase or the introduction phase, there is the working phase, and there is the termination phase. So when we are saying pre-interaction phase, this will begin before the nurse first has contact with the patient. We are looking at the time in which the patient starts exploration. So during pre-interaction phase, patients may have a little bit of good insights to do with their self-awareness. That this thing which is happening is not normal. I need another person to help me. So this comes to light because the patient has this self-awareness. So pre-interaction phase, patient recognizes signs and symptoms, okay, that are there, and then the patient is now looking or will try now to seek for help. So now, in the introductory or orientation phase, it's now when the patient has now come to see the nurse or the clinician. The nurse and patient first are going to meet within the introduction and orientation phase. So the nurse's primary concern here is to find out why the patient is seeking for help. Okay, so the patient and the nurse here together are going to formulate objectives on what should be achieved within this therapeutic relationship. And it will also help establish a climate of trust. Okay, it should also help to establish understanding. It should also help to establish acceptance and also improve communication that is there between the patient. This, in short, there should be a good rapport that should be built between the patient and that one who is being cared for. So in here, within the orientation phase, you may formulate some kind of contract with the patient on what should be achieved before patient is discharged. Okay, so now there is the third phase, which is the working phase. Most of the therapeutic work is carried out in the working phase. Okay, problems are dealt with using a problem-solving approach. So a nurse should have problem-solving skills in mental health and also teach patient problem-solving. Okay, like those that are suffering from depression or other stress-related condition, you can teach them problem-solving skills. So a nurse should have problem-solving skills. So the actual behavior change is the focus of working phase. The psychiatry nursing skill of working phase or the psychiatry nursing skill of therapeutic nurse intervention may help bring about the desired behavior change if a good activity plan or discharge plan has been drawn. Then the fourth and last phase is the termination phase. This prepares the patient for termination by decreasing the visits to the patient, incorporating others into the meetings, or changing the location of the meeting. You can make clarity as you are starting the termination phase to the patient so that they do not misinterpret this as rejection. So mutually, you can explore the feelings of the patient that they may have of rejection when you are now applying termination phase techniques. Okay, you can view the progress of the therapy and attainment of goals in the termination phase, that which you can achieve and that which the patient can continue doing on their own whilst they are at home. It's also important to note that you need to remember, or you need to put it at the back of your mind, that people who are mentally ill often possess many of the characteristics of those that are normal. Okay, so likewise, mental health persons frequently may exhibit characteristics also that are similar to people with the mental illness. So you need to draw a line on those items which will show that patient is now achieving normalcy. Okay, so there's no one who is completely normal. All of us, we may be candidates for admission at psychiatry department. So it is important to draw a line on a normal behavior and the abnormal behavior. Okay, so today we have been looking at the mental health nursing skills. Okay, so in looking at mental health nursing skills, we have come up with a mnemonic, BLAST code. BLAST code standing for behavior modification, R standing for restraining, okay, A for assertive skills, S for social skills training or social skills, then S also standing for self-awareness, C for communication, okay, skills, O for observation skills, T for therapeutic nursing intervention skills. So these are some of the most important skills that should never miss in your nursing care. So from me, I'm saying thank you and keep studying.